Welcome to Kayakal Global Skin Private Limited.
Today we have Dr. Shailendra Dhawan with us. He will explain about the treatment about psoriasis and leukoderma. Let me welcome Dr. Dhawan. Drive. We have heard that Ayurvedic treatment and medicines will make slow progress to patients. Is it true?
No. This is a false belief that the transformation of Ayurveda is slow. Earlier Ayurvedic medicines were available in the form of churna, but now it has adopted a scientific form. The medicines which we are using now are in the form of extract. It contains alcoholic extract or herbs. That means it includes complete essence of herbs. This extract is given to the patient. As a result, the doses which is to be given to the patient will be less and medicine will start working even more faster. Secondly, treatment of leukoderma is not like treating diabetes or cholesterol, in which we can fix the amount of medicines that has to be given to the patient. In the case of leukoderma, treatment should be decided according to the nature of patient. It will rely upon certain parameters like the amount of disease affected, discoloration of skin, hair color, etc. If the treatment is done as per these parameters and medicines are applied in an extract form, then I would say that Ayurvedic medicine will work faster. There should not be a doubt that Ayurvedic medicines will have slow transformation, so people have to change their belief that Ayurveda will have slow transformation. Nowadays the transformation of Ayurveda has become faster.
Drive. I want to know one more things. Leukoderma, a skin disease or is related with any other disease?
It is believed in Ayurveda that whenever a person is affected by any type of skin disease, then it is an indicator that the person is affected by some other disease. Among the patients who approached me, 30% of them suffered from thyrotoxicosis. There are also chances for developing arthritis or diabetes. So the patient has to take care of these parameters. In short, skin diseases will be an indicator to show the body is affected by some other disease. If the cholesterol level of the patient is high, small patches will be developed on top of the eye.
Drive. Which are the situations that can cause this disease?
If the patient is from polluted area, then the chances of getting affected by leukoderma is also high. Over these years we have organized certain camps, and from that we came to a conclusion that the patients from industrial areas will have more chances to be affected by leukoderma. The patient from villages have less chances of contracting, whereas the patient from mining areas, like copper mines, have rare chances of getting affected. From this we could understand that polluted areas can increase leukoderma, and whenever there is presence of copper, then the chances of getting affected by leukoderma is less.
Now let's see the interview of a patient.
My son was having white patches on his lips. I was not much serious about this. But later I took him to a doctor and he asked me to take my son abroad for further treatment. We have taken him abroad and consulted a skin specialist. After 5 to 6 months of treatment, he informed us that he cannot be sure about the complete recovery. I cried a lot for my son. My mother-in-law had given the number of Dr. Dhawan. I've consulted him and doctor told me to be calm or else I may not be able to see my recovered son, as death will part me from him if I continue to live in grief. He had given me great confidence so that I saw Almighty in him. He had proven his word right. It took 1 year to get well, but my son was totally all right. I thought it would take years of time to get recovered, but my son recovered soon. Now if someone approaches me, I would give his number and ask them to consult him at least 1 time, and you can see the result soon. Thank you. Drive.
Doctor, tell me something about this case.
When the patient had approached me, the family was in a totally broken down situation. They had consulted many doctors and taken many medicines, but still it was of no use and the disease was spreading. Now I believe that it is a boon of Ayurveda that the patient recovered completely. I've also noted that if patients are dedicated parents, those will be recovered soon because they will take care of them and provide medicines on time.
Drive. Yours clinic is at Faridabad, Delhi. If the patient is from faraway place, then how would you treat them?
If that patient had consulted me at least once, then I can send medicines by courier. If the patient is too old and cannot travel, then if they send their photographs, then I will send medicines by courier, but only after telephonic discussion. In most cases I recommend to consult me at least once.
If you want to know more about psoriasis and leukodema, then you may contact Dr. Dawan. Doctor, you have given an informative talk. Thank you so much.